can the community itself do to sort of take care of itself?
Just quickly, there's about 4 million people who live in Alabama. About 1 million live around or beneath the poverty line. So for our state, expanding Medicaid would have brought about 1 million people, or maybe 800,000, into care that don't have care otherwise. And that gets to the point beyond HIV to many other things like we talked about earlier. The Ryan White Care Act helps, that's resources. Federally qualified health centers help, but it's not sufficient to really maintain a really strong health infrastructure for people, not just with HIV, but with all chronic diseases.
Can I mention just one other thing too? We spend about $22 billion a year domestically on HIV. So while we do need new resources, another part of the equation is to better target the existing resources that we have. And something that took place when Douglas Brooks, who's in the audience, was in the White House, as well as Jeff Crowley and Grant Colfax, was that we made sure that existing resources, particularly for HIV prevention, were going to those states that need it the most. So historically, the formula was to go to states in the West Coast or on the East, where the epidemic was older, but not necessarily the emerging epidemic that we see in the South. Under the Obama administration, we made sure that we changed that so that the resources were going to the southern United States, where the epidemic was emerging in the newest. So sometimes it's about really just making sure that you take a look at the existing resources and try and figure out whether or not we're spending and allocating it in a way that makes the most sense in terms of what's taking place nationally.
Okay, and just let me quickly follow up. Okay, fine, but I guess I would ask you, how do you sort of craft the message or the campaign that says to people, you know, this is something really important that we need to do, and we need to send these resources here. Again, like I said, it just, I'm glad we're optimistic, but it doesn't seem that.
Well, I mean, it goes back to also what Mike was saying, is that, you know, we really are in a tale of two cities here with the HIV epidemic nationally. We're seeing decreases in HIV across the nation, including in some southern states. There are no places, there's no states where we're seeing increases in HIV. That's the great news. We're also seeing decreases in HIV over the past 10 years for women, for some groups of gay men. We're seeing them among African Americans and other populations. All wonderful news. The problem, though, is that there are other issues that are taking place. Those are those hot spots where we're seeing some lingering problems. And, you know, the lingering problems are primarily centered in the southern United States. If we want to get to the point where we keep saying that we have the tools to end the epidemic, that we can finally end the epidemic, we need to focus on those places where we really need to make the biggest changes to end the epidemic. And right now, that's the southern United States. And I think that that's a message that many people can buy into, saying that, you know, we are so close to the end, but to get there, we need to make sure that we focus on those places that would make the biggest difference in getting into the end. And you see that among a lot of the advocates. The advocates in the national communities, it doesn't matter if they live in San Francisco, it doesn't matter if they live in New York City. Many of them are on board with making sure that we target our efforts to the southern United States to make the biggest bang for our buck.